So early literacy instructional priorities. So one thing that you probably have heard about or read about, or if you look at Facebook, you've seen this on Facebook in some of the pages there, and that is that we're having a problem with children learning to read in the United States. So in recent years, people have thought that we're having some sort of a crisis in reading achievement, and they have good reason to think that because about a third of our children in fourth grade read below basic. Below basic would mean that they couldn't read, if that's where they stay, they couldn't read a newspaper or magazines. Those are all written at about sixth grade level. So if our children stay below a third of our children stay below basic in fourth grade, we are in trouble. So in response to that, we have seen sort of a surge in the term the science of reading. Now, the science of reading is not a curriculum, and it's not a philosophy. It's a collection of research that tells us how children learn to read and what some of the best methods for them to learn would be. So that's what the science of reading is. So it's not a curriculum, it's not a philosophy. But we have, in our search for better ways to teach children to read, we have had some national panels, both the National Reading Panel in 2000 and the National Early Literacy Panel in 2008. And those panels have searched and done a lot of meta-analysis of research projects, and they've come up with 4 priorities. One is oral language, the other is phonological awareness, another is print awareness, and the last one is alphabet knowledge. Those are the 4 instructional priorities for early literacy instruction. So when we think about those priorities and we think about how we came upon the decision to name those as the 4 instructional priorities, we know that a lot of the instruction for children comes to us from universities where we teach our students to teach children, and it also comes through programs from the United States Department of Education. And one of the guidances that we can get now is a guidance for early reading first programming, and that is one of the grants that Eva and I have worked in. And so in that grant, we see also that they named the 4 instructional priorities: oral language, phonological awareness, print awareness, and alphabet knowledge. One of the quotes that I think is interesting and that you might find interesting is from Gail Gillum, and she's talking about scientific evidence and how it has shifted the profession of speech-language pathology to a position where it's no longer acceptable to claim successful treatment of children with speech-language impairment if the outcome is improvement in only spoken genres. So she completes her statement with treatment outcomes for children's written language development must also be considered. And so our treatment for those children would be using those 4 priorities for sure. Those 4 priorities, again, are oral language, phonological awareness, print awareness, and alphabet knowledge. Now, the top 2 boxes you know a lot about. The bottom 2 boxes, we all may need to learn a little bit more.
So let's think about speech. So you have a child who is having difficulty producing the voiceless sound that we represent with the letter P in your treatment sessions. So let's just look at this example about how many domain concepts you can introduce. So let's say your activity is working on the initial sound in a word, in words. And so here are the pictures you're introducing. We would suggest you also pair them with print on the front side of the card or with the picture or the object that the child is looking at. And you're going to have the children sort foods by listening to the first sound in the word and repeating the word after you for production. And you're going to explain to the child that some of these words have your target sounds at the beginning. They're all foods. Some of the words have a different sound at the beginning. So when we finish making the sound, when you finish saying the sound, we're going to sort the words and we're going to count the number of words with your sound and the number of words that don't contain your sound or have a different sound. And then we're going to put them on a graph. So you know what the target phoneme is, of course, and you might want to simplify these instructions to match the children, of course, and their abilities. But look at how many domain concepts you're introducing. And the ones that I think you're probably introducing include math. You're using a bar graph, include language arts. You're learning words and associating them with real foods or with pictures of foods, and you're learning science in the food domain. So at any rate, what you're already doing, what you're going to do is just think about it as being part of developing world knowledge. You could also have the children, now which one of these could we grow in a garden? Which one of these would be a meat? Which one of these would be a vegetable? All sorts of ways to increase world knowledge as you're working within your speech sessions. So Shirley has shown you a technique, a method, turn and talk that incorporates the important elements of language use and comprehension that underlie literacy, and also examples of charts that bring some print to that event as well. We're going to look at another possible way that you'll be interacting directly with teachers in the classroom and perhaps families, and that is in a routines-based type of intervention. So we're going to lead you back to the Scarborough rope, which we've used quite frequently during this presentation, and to remind you of the language comprehension areas. You're well versed in these areas. Oral language is the priority we're discussing now. And we've also talked about oral language being a shared responsibility, shared among families, shared among educators, shared among specialists. So we have given abbreviations to all of the elements in the language comprehension strands on the rope. And we're going to look at a table on the next slide and think about routines. Now, I'm going to suggest that in an IEP meeting, you most likely have classroom teachers or whatever early childhood educator the child has at the time, families, and perhaps others who work with the child within your IEP meetings. So if you think about this language strand being a shared responsibility, if you provide to them a chart thinking about the routines in which they can share your goals, this might be a way that you could think about doing that. You see at the top of the chart classroom routines, and you see several of them down the left-hand side. These are common routines. It also includes extended opportunities. And across the top are some common goals we see from the SLP working with young children. Answering for WH questions, using expanded noun phrases, talking about story characters, settings, etc., story grammars. So if you see how we've looked at that, we can target almost every one of the strands on the language comprehension section of the reading rope that Scarborough gives us. This might be a good way to show how everyone can support the oral language goals, and if you can incorporate a discussion of how print might be assistive, for example, in learning centers with labels, etc. In Shared Storybook, of course, you're using a print event to target the goals. So this routines, a look at routines and how our goals might occur within them might be a good way to have everyone share the responsibility with you for language and early literacy. Now, we're going to start with a series of video clips, brief, between 2 and 3 minutes. Each of these 3 video examples you'll see is conducted by a speech language pathologist. They are all providing these sessions within the classroom setting. Some of the children in their groups will have speech and or language disorder, and some or most will not. But these are examples to look at some of the elements that Shirley and I have just spoken about that are supported by research. So you see on the right what you might want to observe that Mary Joan is doing.
Right? We're going to talk about zzz.
Here's a zebra.
For a zebra, that is a Z word. Zzz is in the front of your mouth. Who
Me
feels it?
too.
Who feels it tickle?
Me and you.
Where's your tongue when you say that sound?
And back.
In the back or behind your teeth?
Behind.
Behind your teeth. Is your tongue through your throat? Zzz. Is it wiggling down there?
Yeah.
So your
That's
voice is,
wiggling
and your
now.
voice is on, so it's a loud sound, isn't it? Okay, and here is letter
Z.
Z. Letter
For
Z.
zebra.
Yes,
Zoo.
that's right. Well, you know what? A zebu, zeppelin, and a. What's this one that Anna colored?
Zebra.
Uh-huh. All right. And what's this last one? Do you remember what it is, Isaac?
Mine
Yeah, that's a big word. Okay, let's review it, okay, guys? Are you ready? Say it with me. Zero.
Zebra.
Xenia. Zebrafish and zeppelin. Very good. You guys did a great job with letter Z. What sound does he make?
So I think you can see much of what we've discussed, and perhaps this is what your sessions look like as well. And if so, you've done a nice job of infusing phonological awareness into this brief part of a session. You see someone, that actually happens to be me, referencing print as I read a book to young children. And you see an SLP on the bottom who has adapted a book, and she and her assistant are pointing to the words as they read to children and teach them within this book. So those are 2 examples of supportive pedagogy. SLPs in print, we have a quote here from folks. This occurred in the journal Seminars in Speech and Language about SLPs and print. The title is The Role of the Speech Language Pathologist in Improving Decoding Skills. So we're very accustomed, as you know, to the side of the model for the simple view of reading, to working with oral language, language comprehension. But we're also seeing more and more, and in more and more articles, how we can improve and be part of the improvement of that other side of the model that we call decoding skills, and in the 3 to 5-year-old population, laying the foundation for that. And here's the quote from that article. SLPs should play a direct role in teaching letter identification skills, especially with preschool children who have speech language delays. So we've looked at 2 things we've talked about here: direct role, explicit instruction, and the age we're talking about, 3 to 5-year-old preschool children. We also know that those who have speech language delays, we've talked about this a lot, are at great risk for reading difficulties. These authors tell us that speech therapy in particular provides excellent opportunities to teach letter identification. So when they say the letters corresponding to the target sounds we're teaching should be routinely present during speech activities. And we see some examples of materials that we routinely use. The target sound here is, of course, f, that corresponds with the upper and lowercase letter F. You see that you could also use the card on the left. It's made, such as you could use an onset rhyme blending with children. It's a reminder to you on the back of the card. And you see that the print that faces the child with the picture is on the front of the card. So here we're seeing orthographic facilitation. We have the opportunity to reference print, and we have the opportunity to use printed letters to say this word is fan. It starts with f, also corresponds to these letters. This is F. This is an uppercase F, a lowercase f. So we have the opportunity to make the instruction direct and explicit. So I'm going to introduce the first of two handouts for this session. This particular handout is for your use and reflection. It's called Comfort Levels. Shirley just spoke about research that talked about the years of experience, location of practice for SLPs, and those who most likely would infuse literacy training into their treatment. So we'd like for you to reflect with this chart. You'll see that this slide and the next are on the handout I'm referring to. The name of the handout is the same as the slide, Comfort Levels. And you'll see across the top where we've described what it means if you're uncomfortable, moderately comfortable, or comfortable. And so you can read down the list of each with the highest level of uncomfortable being you don't know the research at all. Maybe you didn't receive pre-service instruction, maybe not attended PD, professional development, or maybe haven't seen demonstrations, all the way up to comfortable, that you know the current research well, that you've received perhaps pre-service or professional development sessions and have observed demonstrations on how to instruct. If you go to the bottom part of that handout, what you'll see here is whether you should mark what you're comfortable, moderately comfortable, and uncomfortable with on the reflection handout. I'm going to assume that you will mark that you're very comfortable in the area of oral language, probably in phonological awareness, and then judge how you feel about the other two of the instructional priorities and the pedagogy. So this is for your use to reflect upon your practices, what you have thought about as we've moved through these 6 sessions, and to determine your comfort level. I would also at this time like to introduce you to the other handout. As you know, for each of the sessions, we have given you a checklist for the 4 instructional priorities. The checklist that we have for this session is called Infusing Literacy into Clinical Interventions and Work with Colleagues and Families. And you'll see, as Shirley talked about earlier, in your clinic or therapy room, you have some things that you can consider for your physical environment, in your direct treatment, your instructional environment, with working with colleagues or interprofessional practices, and with working with families. So those are the last 2 handouts for this session. So this slide talks about a quote from Dr. Grover Whitehurst. You'll see it's in 1992, from 1992, and I'm sorry to say that what he states in 1992 is still correct today. Over a third of the children in the United States enter school unprepared to learn. A third of our children. You see the graphic on the right represents that. They lack the vocabulary, sentence structure, and other basic skills required for school success. And we know from a graph that Shirley showed us early on in this presentation that children who start behind generally stay behind. The gap grows wider. So you are an important element in changing this picture.